all of us have this inner healing consciousness, this inner healer that's inside of us that can inform and guide and direct us. We have to make time for it, and we have to make those connections with the inner healer. And so the book helps with guiding people into that connection with their deeper self, with their wise self, with their intuitive self, with their dream self.
UnLost Cause is a community that shares stories of individuals 40 and beyond who found the courage to reclaim their dreams and live without regrets. I'm David New, and I hope these stories help you find joy, purpose, and passion in a life true to you. Today's guest is Gayen, a licensed mental health counselor, author, and pioneering psychedelic therapist who blends science, spirit, and storytelling to help others reclaim their inner healing. Her UnLost Cause? Reinventing herself in her 60s by stepping boldly into the world of psychedelic assisted therapy, once considered controversial, to now a legal and life-affirming calling. Gayen, welcome to UnLost Cause.
Thank you so much, David. And I'm glad this is an unlost cause, because I think it really is one that's going to help and support many people. Obviously, psychedelics aren't for everybody, but for some people, it really is a life-changing experience. And so much more research I know we'll touch on is getting into that.
Yes, of course. And so before we dive in, can you share with the UnLost Cause audience what you and or your business does in 2 or 3 sentences?
Sure. I'm a licensed mental health counselor and a credentialed addiction professional. And I have done the MAPS training in 2021 so that I could understand MDMA therapy. And they were some of the best teachers in the world. Then I went on to study it in the Netherlands and at the ICPR conference, the International Conference on Psychedelic Research. And so I really dove into the study and how to do this in the most effective way possible. I only use legal substances. I am not underground. I'm above ground licensed therapist.
Good to know. Good to know. Or yes, we're all legal here.
Yes.
So, Gayen, I'm curious, like when you were a child, did you experience therapy or were you around therapy? I mean, how did that? Because oftentimes what we do today can be so rooted in our childhood. So I'm just curious, did you have any exposure to that growing up?
Well, I think the best exposure that I had, and it's as relevant today as it was when I was 13 years old, is I was introduced to a particular kind of teaching, and it was a teaching of metaphysics. And my father had these books, Secrets of the Ages. His father gave them to him, and my father gave them to me. And they really explained a lot more about our connection and consciousness to a universal mind, divine intelligence. It helps us to understand what lies beyond the reality that we can see, feel, taste, and touch. So that was a really good foundation for me to understand that this dimension was just one dimension, but there were other dimensions beyond what we could see, feel, taste, and touch.
And then I know that there's some, especially children, when they're growing up, they seem to be able to communicate with these different dimensions or sense things that other people are not, especially as they get older. Did you have that phenomenon growing up, or did you know people with that phenomenon?
Not necessarily. However, there's a wonderful therapist who has written a book, and it is, I can't remember her name, but she is basically saying in the first few years of life, basically that child's and the baby's brain is a tripping brain, right? It's having psychedelic experiences all the time. And they look at their hand and they go, oh, wow, this is my hand. And then as they grow up, they begin to have tea ceremonies, right? And there's people that are there with them at the tea ceremonies. And so this rich development of imagination and intuition and this openness that the brain has in early development is really incredible. And psychedelics, to a certain degree, give us that freshness that, some people describe it as the new snow, that like you're skiing down a snow path that has never been skied down before. So, the psychedelic medicines have that potential of opening us up to that new pathways, the neural pathways in our brain, and kind of give us that openness and plasticity again. And so from that standpoint, my first experience happened when I was 16 years old. And I'd be happy to share some of that story if you like.
Yeah. So how about before we go there, prior to 16, what was your childhood like? Was there a lot of curiosity or is it very rigid or like, tell me about Galen growing up.
So Gayen growing up had the best of both worlds, really, because on one hand, I had my father who is really much more of a metaphysician and interested in health and wellness and the mind body spirit connection. And my mother was more of the American Baptist. And in the American Baptist tradition, there was a lot of ritual and ceremony and community and connectedness. And my whole family went to one church. And so I grew up with my cousins and aunts and uncles and grandparents, all a part of this extended spiritual community. And ritual and ceremony became a very important part of that. So you can kind of see, with my book, Psychedelics, Dreams, and Rituals, the psychedelics were there and they became more prominent, but dreams were always emphasized by my dad. Like, what did you dream about? And, what did you see? Because he valued dreams. He valued what the mind was presenting us with, information, insight, intuitions. And my mom valued community and connectedness and ritual and ceremony. I was, fully immersed in my ritual of becoming baptized, as a young person. It was a meaningful experience to me. So it was a blend that was really influential and had a very positive effect on developing my spiritual life and that mind, body, spirit connection.
And then you had mentioned that there was a English teacher who was very influential. Did that happen prior to what you're going to talk about at 16, or did it happen afterwards chronologically?
Chronologically, it happened just afterwards. So on my 16th birthday, a friend of mine had given me some LSD, a purple microdot, little tiny teeny tablet of LSD for my birthday. And so I had it and I went into the bathroom at home and I looked at myself in the mirror and I said, Happy 16th birthday. This is going to be a really interesting day. And I put the tablet in my mouth and I went to school.
What?
I know. That's a part of it. Everybody says, What? You went to school? Yes, I went to school. So the bus ride there was very nice, gentle lift off, got to school, and everything looked a little different. It was as though I realized for the first time I wasn't this physical body. It was like a suit of clothes that I was wearing, but I could move around in this body. But there was something greater that was animating the body. I could connect and see almost like I was connecting with the thoughts and the feelings and the vibrations of other people. I was much more in tune and sensitive to that. At one point, I had to go to the bathroom. And so I was in my English class and I asked for permission to go to the bathroom. And I went to the bathroom and there were mirrors all across the wall. Wow, this is my first time of mirrors and psychedelics. So I went into the mirrors and I saw for the first time how many other dimensions there were beyond this dimension and that I existed on each of those dimensions, which was enthralling. There was no fear, there was no trepidation, there was no anxiety. And I think that perhaps in my early readings in metaphysics kind of laid a groundwork for that. And so that's where that kind of links in. So I had some, awareness that this wasn't abnormal. This was normal. I was just it was like an aperture opened up and I could see it for the first time. So I was in the bathroom for a very long time because, of course, when we're using psychedelics, we completely lose track of time. There is no time. And the bathroom door banged open and I jolted back and it was someone from my class and the teacher had been looking for me because I had gone to the bathroom and been gone almost the entire class period. So I was not really smart in that moment. I guess I was very open and I told her what I was doing, that had taken some psychedelics and that I was on this journey. And she immediately went back and told the teacher, like, oh no. Now remember, at this point, It's about 1972. And in 1970, we had a complete shutdown. It was a U.S. Controlled Substances Act was put into place in 1970, and all the psychedelics were Schedule 1. So that posed a big problem. So I went back to the classroom. She told the teacher, and he was not happy with me. He said, go see the nurse. I said, okay, I'll go see the nurse. I pulled it together. I wasn't afraid. I just went down to the nurse's office and I told her, oh, it's just that time of the month. I wasn't feeling really well. I spent a little extra time in the bathroom. She was really busy. And in those days, you had to have a pass to get back into class. She gave me a pass and I went back to class. And so when I got back to class, Mr. Sipos, who was my English teacher, he just kind of looked at me with a suspicious eye. He goes, are you okay? I said, I am. I'm really okay. So I sat down and I went through the rest of the day at school. So what happened a few days later is that Mr. Sipos asked me, he said, look, you could have gotten in trouble. I don't want that to happen to you. But what I do want to ask you to do is I want you to write about your experience. And I want you to write about your experience and share it in the context of the yearbook. And I want you to be a writer for the yearbook committee.
So this other student comes into the restroom, is banging on the door, and she finds you there. And then what ends up happening?
So I'm so transparent and honest in that moment. I tell her I am on psychedelics. I had taken LSD and I was rattling on about this experience. And she just looked at me and I don't know why I thought I could trust her. And she went right back and she told the teacher. And so I come into the classroom after she had told the teacher, and he is really concerned. Like, how am I going to, am I okay to be in his classroom? And I looked at him and I said, I'm okay. He goes, go down to the nurse's office. And I said, okay. And just for background, this is a younger teacher. He's probably in his mid to late 20s, English teacher, really kind of inspiring in many ways. We had good rapport. I was a good student. I am a good student. And so I went down to the nurse's office. I made up a story about, it was that time of the month and I was just in the bathroom for a long time and she was busy and she just was like, okay. And she gave me a pass. And so I went, I was like, oh, what a relief. So I get back to the classroom. And even as I'm walking back to the classroom, I'm just hearing these conversations as I'm walking through the hallway and I'm sensing this, I'm in this building with hundreds of students and teachers and like just kind of experiencing the whole thing in being in school in a different way, like as if I was in school before, but now I was kind of looking at it from above, as if I could see it as a bigger picture and why we were there and how this was all kind of unfolding. So I get back to the classroom and I give him the pass. I said, I'm okay. And he said, all right, go sit down. So a few days later, he came to me and he said, you could have been in really big trouble, because realize at this point, there is all of this, all the psychedelics had been Schedule 1. So there's a U.S. Controlled Substance Act that went into place in 1970. And here we are in 1972. There was still underground stuff available, but it could be very detrimental. And I was smart enough to know I didn't want to get in that kind of trouble. So a couple of days later, he said, look, you could have gotten in a lot of trouble. I'm not going to say anything. However, I would like you to write for the school yearbook, because he was in charge of the yearbook. And I said, I would be happy to. It would be my pleasure. And so he started me. He ended up being my first psychedelic integration person. I didn't even know it because he asked me to write about my experience. And so I put it into poetry. I wrote about it. And he really set me on a path I couldn't have even imagined of being a writer. And having that experience of, capturing my experience, understanding it, by digesting it through writing my story and writing poetry. So one of my first poems that I wrote was put into the yearbook. And, interestingly enough, it was about the doors that I open. I'm the only one who can close those doors. I open them. And I didn't even have any knowledge at that time of Aldous Huxley and Doors of Perception and, you know, all of this kind of metaphoric relevance of how we open these doors inside of us and that it opens us to a wider reality.
It seems like the journey or the trip that you were on was very positive, right? And I think a lot of the research talks about set and setting. And I wonder, do you think that's related to the fact that your dad, you study metaphysics and you're talking about these other dimensions that you were very open to it. And on your 16th birthday, you're like, happy birthday. So it's a very positive one versus, and just for the audience, and correct me if I'm wrong, Gayen, but set is your mindset going into a trip or a journey. And then the setting is like, hey, are you in a safe place or a chaotic place? But it felt like you had a good experience. And do you think it attributed to that set and setting that you had at home with your parents and then in a safe environment at school?
Yes, I feel like I had a container, and I think that's kind of an important piece of this. Now, I want to say not all 16-year-olds have the container that they can kind of let this experience land in, and they can hold it in a space within them, mindset and, you know, kind of the container to hold the psychedelic experience in. And I felt like I had an advantage because I had been working with some of the dream realm. I had been working in the metaphysical realm. I knew that there was an consciousness that was beyond me that I was also connected with. And it really had to do with a lot of my spiritual life too, because I really had a rich spiritual life. And that rich spiritual life was only enhanced in many ways by my psychedelic experience. Again, having said that, would I recommend psychedelics for 16-year-olds? Not unless it was in a therapeutic setting and they were really prepared. And then it's even a question of, do they have the container with which to hold this very big experience in their life? I think you have to be mature mentally, emotionally, and you have to have some spiritual, emotional grounding. So I felt like I had a great advantage and I had an incredibly wonderful experience. And I did not realize at the time, and there's more to that story, that this experience was going to go on for the next 12 hours.
Oh, wow, wow. Yeah, so one of my questions was like you said that the experience was messy, but had a lot of revelations, right? So what would be like, if you can share with the audience, like the top two like takeaways or revelations that came to you, as a 16-year-old?
I think the most important thing that came to me as a 16-year-old is that I had been, as many 16-year-olds are, very identified with my body, that I was my body and my body was me. And one of the big revelations is, oh, this is just a suit I'm wearing. It's not who I am. And there's a kind of relief in that in a way, you know, a little bit more room to kind of grow mentally, emotionally, kind of aware, because you can see even today, there's such an emphasis on how you look and what your body looks like. And, you know, and that over identification with the body can be obsessive and can lead to so much unhappiness. And to recognize that this was just a suit of clothes that I was wearing was a relief. You know, it's like, oh, who I am is way beyond this body. So at 16, that was a big revelation. The other revelation is the dimensions, that I could be on multiple dimensions at one time, and I could see into those dimensions. And that allowed me a kind of expansiveness and an openness that maybe in some way gave me a deeper spiritual awareness and a little bit more courage in some way as a 16-year-old. So I was like, this experience has, you know, you can say we want this experience of being enlightened, right? And sometimes, if we're lucky, we get little teeny tiny glimpses of that, what that actually is about. And at 16, I had that little teeny tiny glimpse of what it is to be, you know, open to that enlightenment, so to speak.
And then, so that was 16. And before you go off to college, you have a couple more years in high school. How did that experience ripple through the couple years of high school and then starts bleeding into where you go to college and what you study for college?
So it had to be like some things in our life, it had to be packaged up. I wrote about it. I wasn't really able to share it with a lot of people because there just wasn't, it was cloaked in legal issues and potential for being arrested, you know? And so I had to be very quiet. And it was like, okay, I had this great experience, but right now, what I'm going to have to do is pack it up and put it away. And it's like, all of us have these kind of things that have happened to us, good and maybe not so good. And we put them in a box and we put them on the shelf. And we say, one day I'm going to go back and I'm going to open that box up and I'm going to explore what's in that box again because I know it's important. And I had to put it in the box on the shelf. And so I leaned more into the idea of dream work, which was very important to me, psychology, which became much more important to me. That's what I began studying, education and psychology, as I went into school.
Yeah. And why did you choose education psychology?
I think I'm a natural teacher in many ways. I love teaching. I've taught, at the undergraduate level in college, and I'm passionate about it. I'm passionate about whatever I'm teaching. And so that was a natural for me. And then the psychology also, because I had this kind of introduction very early on with my dad. He was interested in psychology. He was interested in dream work. He was interested in not psychedelics, but in metaphysics. And he was a big reader. And, I would say too, to, those listening, if you want to explore, you have to be a reader, you know, because we stand on the shoulders of giants. And if we, as we stand in those shoulders, we can see so much farther than the giants. And the way that we do that is by reading and understanding and digesting experiences or information or research that other people have had. And my dad was always leaving books in my room. Here's a book you might want to read. And he just leave it there. He wasn't pushy about it or anything. But because he read, he kind of helped me to become enthralled with reading. And that was, a foundation for the rest of my life.
So then you go to college, and then what were some of the like the broad brush like career stops and chapters that you did after college and the motivation behind choosing those career stops?
Well, one of the things that I think was really important is when I went to get my master's degree, the master's degree was from the Center for Humanistic Studies. It was right off of the campus of Wayne State University at the time. And the school's name has changed. It's Michigan School of Psychology now. But that humanistic Carl Rogers, your experience is as valid in the research as as you're doing your research. So it was based on heuristics and phenomenology, which is a way to do research, which includes the researcher's own experience. And so I chose that school. It was different because it wasn't your traditional kind of behavioral science school. It was more humanistically based. And so as a part of my master's thesis, I wrote on ritual and ceremony. And so what is the power of that ritual and ceremony coming together as a community, celebrating different types of rites of passage or different types of ceremony. And that book, then my master's thesis became the foundation for my first book called Transformative Rituals that came out in 92, So that book became like this foundation for there's other ways to create this non-ordinary state of consciousness. And that's really what the psychedelics do. They create a non-ordinary state of consciousness. Dreams, again, we're entering into a non-ordinary state of consciousness where we can be open to other dimensions, other ideas, it's the dream realm can become almost like a passage. And ritual and ceremony became a non-ordinary state of consciousness where again, there's this openness, this receptivity, this opening on mind, body, spirit level. And most of the time in community that helped in healing, because really we all heal best when we heal together.
Let's see. So you go to college in the 70s, and then you graduate, and then you're focused on a lot of around rituals and dreams. And part of that was this lost cause around psychedelics just couldn't be public because it was illegal and you'd be arrested. So then that's basically put on the in the box, as you call it, and on the shelf. And while you're exploring these other things that you're still intimately, intellectually curious about and think about the positive impacts of dreams and rituals. Is that correct?
That's correct. And so that became the way because there was an openness to that. There was a curiosity about the transformation, that understanding how we could enter into non-ordinary states of consciousness to help us heal, to give us guidance, to give us insights, to speak to ancestors, to connect with, other dimensions. All of those were available through ritual, ceremony, and the dream realm. So that became a focus for many, many years.
Yeah. And so for the listeners who aren't familiar, like what would be like an example of like I don't know, a classical patient that you use dreams and you use rituals to unlock some understanding or healing for them that was very transformational?
Sure. So, one of the very basic rituals that we would often use is called a burning bowl ceremony. And many people are very familiar with this. And it could be a process. I'm thinking of one person that was going through a very difficult divorce. And there was an ending to this, marriage. And there was grief and there was loss and there was hurt and pain and, learning and growing. And so part of this is to do the release work, and we all have to do our own inner house cleaning. It's not just it's a big part of the work that I do with many people. It's like I'm cleaning house with them on the inside. So she wrote down some of the things that she was ready to release. She had worked through some of her grief, anger, denial, bargaining, depression, that was a part of that. And then, finally moving through to some acceptance. And she burned some of what she felt she needed to release in order to move on for herself. And the ritual that she chose to do is to bury the ashes and plant a new tree on top of it. And so planting of the new tree was saying, out of the ashes of what has been, new life grows. And we know this, people are going to die. We're going to get divorced. We're going to have loss. We're going to have, things unexpected to happen. And so, but out of that experience, we will grow. And so the tree then became that place where she was rooted and grounded in herself, in the earth, in nature, and she could grow through that divorce and become, and grow in new ways.
Beautiful, beautiful. And so that's a great example of the rituals. What about on the dream side?
The dream side, one of the things that I think can be really helpful, and I talk about this in the chapter in Psychedelic Dreams and Rituals. Robert Johnson, he's a Jungian. I'm really kind of an amateur Jungian at heart. All of my therapists have been Jungian therapists. So, that's kind of my frame, if you will. And I think in one dream, I'll use my own example of a dream. I had come to me this sense of loss that was about to happen. And it was really difficult because I couldn't really digest it. And I was previously married and my husband unexpectedly passed away. But the dreams began to kind of prepare me for his passage. And that's pretty shocking, And so part of the ritual that I did, and I wanted to spiritually prepare myself. I talked to my husband about it and I said, whatever we need to do to help this, I don't want you to go. What do we need to do? And yet, at the same time, there was this deeper knowing that it's almost like each of us have a time frame when we're going to be here on the planet. And when that time is up, it's up. And acceptance of that is important, even if that's not what we want to see happen. And I feel as though having been able to talk with him and share that with him and connect with him and really kind of come into an appreciation of each day that we had together was really important. So fast forward, he has a massive heart attack. He passes away and I don't get to say goodbye. But I had already kind of had this, because I paid attention to the dreams. I connected with him in love and partnership. And so that night I go to sleep and it's fitful because it's my first night and he's gone. And all of a sudden, I'm woken up by him calling my name. And he says, Gaylin. And I'm like, I had that sense he was here. And he says, get up. And so I'm like, I get up and he goes, look out the window. And I look out the window. And when I look out the window, the sun is just rising. And he says to me, and it's a line from a favorite poem of ours, it is not death, but dawn. And just in that knowing, it's not death, it's dawn. There is a dawning of a new day for him. He's just in that other dimension. And it gave me such peace, And so I write about that. It was still grief. It was still loss. There was 3 huge funerals that followed. And it was because he was very well known and loved, and he was a prominent teacher in his own way. And so, it prepared me with the dreams for this passage, and then having that connection dimensionally through the dreams and having this love connection with him that was already established, he then could kind of come back to me and we could still have the connection, be strong and communicate. And he still comes back to me in my dreams periodically. It's so good to see him. I don't feel that, it's a complete disconnect. Does that make sense?
Yeah. Well, that's wonderful. Thanks for illuminating for the audience, like on the ritual side and then on the dream side. So I want to start transitioning to the lost cause that became an unlost cause. So you had to put your LSD learnings and experience in a box because of, the legal regulatory framework. But was that hard? And did you ever see little like the box was shaking on or like little light coming out of it, like, hey, open me, free me, like I want to work with you, or like, were you able to just like bury it and not come back to it until things started changing on the regulatory front?
I had to put it on the shelf until it changed on the regulatory front, because really what we're talking about, it was a combination of social, political, and scientific factors that had to change. So socially, they had to be able to, and we're still struggling with that socially. Politically, there's more political will on both sides of the aisle because they're finding the psychedelic medicines and plant-based medicines to be so effective to treat veterans and first responders. And so there's political will now to see these medicines used in a very helpful, healing way with our veterans. And I work with veterans, and I agree. I mean, I found it in my work. I can use ketamine assisted psychotherapy, and I'm trained in ketamine assisted psychotherapy, and that's what I can deliver. So at the time, I've been a decades member of the American Psychological Association. My license is my bread and butter, so I really have to protect my license. And so I wanted to stay within the legal framework. But in the APA magazine 5 years ago, there was a little teeny tiny article in the back of the APA monitor, and it was about psychedelics. And I was like, this is interesting, that the APA is talking about it. Fast forward, this first issue that came out this year for the APA magazine had the top 10 trends on the cover. And one of the top 10 trends in psychology was psychedelic medicines. And so we went from a little teeny tiny article in the back of the APA magazine to the front cover, top 10 trends, and psychedelics being one of them. So I started when it was 5 years ago. It was a teeny tiny article. Then the box started shaking. It was like, yeah, I'm here. Okay, we maybe can do this again.
And then just help the audience understand what is psychedelic medicine, or what's that classification? What does it mean, and what is it?
Well, the psychedelic medicines are, it depends. I'm trained in MDA. MDMA is a empathogen, opening the heart. It's excellent for couples and couple therapy. I just took a workshop on MDMA and couple therapy. It just helps us move beyond our own blocks and our own ego and kind of open that empathy for one another, to see and embrace one another in a different way. It's amazing in that way. It's been still available underground, but I don't work underground, and it's still not legal, so I don't have access to that, but I'm trained in that. The LSD, again, it's not widely available, but the research that has been done on it, Amanda Fielding, who just passed away recently, God bless her, she did so much research and funded so much research and got the willingness to explore and do scientific research because there was some block to even a willingness to research this. And Robert Carhart Harris, who is a researcher in England, brilliant man. I just had the opportunity to meet him last week and thank him for all the work he's done. He classically did the MRIs, and this is the connectedness of the neurotransmitters while your brain is not on psychedelics. They were using psilocybin, LSD. They were researching a variety of types of medicines, and then the connectivity and how the whole brain comes online. It gets past the default mode network. It's able to open to regions that it normally doesn't open to, and it expands our worldview. So that can happen with variety. Psilocybin is probably one of my favorites. I studied psilocybin in the Netherlands because it's legal. I mean, I literally could ride my bike to the store and go into the store and buy truffles, which are legal in the Netherlands. And so that was a wonderful experience to be able to legally, they're ahead of us in that way, but they're just approving ketamine for use in the Netherlands. So some medicines have approval in some places, and here it's ketamine. Ketamine is probably one of the most researched. It's been researched over 50 years. Ketamine was originally kind of used during the Vietnam era because it was a really easy anesthesia that didn't really involve the respiratory system. And so they could stabilize soldiers that were wounded on the battlefield. And then once they were stabilized, they could transport them to the hospitals. But they began to see that these soldiers were actually happier too. And it was like, wait a minute, I know we stabilized them. I know that we got them to the hospital, but why are they happier? And so they began to look at how the ketamine can help with the neurotransmitters and the rewiring of the neurotransmitters and the plasticity of the brain, which has all just been like evolving so beautifully now with the scientific research to back it up.
Yeah, and interestingly enough, and at least because I'm a lay person, but when the book How to Change Your Mind came out by Michael Pollan, which I believe was very well written, what was the reception for, like, from your point of view, being on the inside or being a therapist, where you're like, oh, this is garbage, or wow, this is exciting, and this might cause more momentum? Because I believe that predated Oregon and Colorado's measures to legalize psilocybin.
Yes, I was delighted to see the way that Michael Pollan, I mean, that's why they call him the pollinator, right? He just took this idea and he really introduced it to us all in a way that was highly digestible and engaging and interesting. Because I've worked so many years in drug and alcohol rehab, I spent decades working in, drug and alcohol, especially during the opioid crisis. And it was just, heartbreaking to see all these young people, dying and losing their life to, overdoses, and so I was really interested in, there's got to be another way that we could approach this. And one of the chapters that Michael did, and this was from the early research in psychedelics, is they found that psychedelic medicines worked very effectively with addictions and alcoholism and drug addiction. And so he really explained and told the story of Bill W. in such a beautiful way that, in fact, one of the founders of A had been helped through the use of belladonna. When he was detoxing in the hospital, they gave him belladonna, which is a psychedelic medicine, and he had that white light experience. And from that moment forward, he never drank again from that time on. Now, he knew that he needed to have, here's that ritual and ceremony. You got to have community. You have to have, and, A and the 12 steps are a wonderful framework for a ritual and ceremony that people can enter into in very community-based, loving ways to care and uplift one another. And so Pollen really, he connected those dots in a way that no one else had. And that was just one part of the book. And so it's kind of a funny side story for me because I'm in recovery and my husband's in recovery. And so I started to read to him Pollen's book and talk to him about psychedelic medicine. And he looked at me like I was crazy. He goes, "What are you talking about? This is, I've been in recovery for decades now." And I said, "But there's something here." And so it wasn't like, "Oh, yay, this, automatic receptivity" at all. It was just kind of like an engaging, looking into, verifying, looking at the research. And then I began, and we're big readers, we're big book readers, and we began to read and explore and investigate deeper. I was very fortunate to be one of the students that got into the MAPS training program. The Multidisciplinary Association of Psychedelic Studies did a phenomenal class that was available. There was actually 500 of us from all around the world. We studied with the best teachers. And then I became MAPS accredited with MDMA therapy. So that foundation, studying that, and then my husband was like, "Okay, all right, I see this now." And we joined together really, and he's incredibly supportive of me because I'm doing the work and he's supporting me as I'm doing the work. And we found it to be really, some people might say, "Well, is this a shortcut?" I don't think it's a shortcut. I think it's a kind of cutting through to the core or the root of the problem. And the psychedelic medicines give us a little bit of an opportunity to open up those pathways and work through some things that normally would take months and months and months and months and months of therapy, where I can do this work with people over a period of weeks and they see some change and they feel better and they understand themselves.
Yeah. So as I think about this wonderful story, Galen, would it be correct to say that, you had your psychedelic experience when you were 16, that had to go in a box. So then it became a bit of a lost cause until some of the new things passed. And now this UnLost Cause being the MAPS program sounds like it was very formative for you. And now you're able to leverage psychedelics to really impact healing in a new way for your patients.
Exactly. And I found a ketamine infusion clinic, and the doctor I was working with there did the medical part of it, and I did the therapeutic part of it. So there's different ways that ketamine is administered. One is as an IV, and it's used just as a medicine. And I'm utilizing the ketamine as a therapeutic tool, which is a little different than just doing the infusion. That means I meet with people, I talk with them about the generational patterns, I talk with them about the kind of places where they may have unconsciously let patternings and programmings run rogue beneath the subconscious level and help to bring that up to a conscious level, then having access to that, kind of rewriting those patterns and rewriting the scripts and understanding the different parts of ourself and how different parts of us are influencing either, negatively or positively our life experience.
Yeah. And so when you think about dreams, rituals, and psychedelics, when you're treating your patients, when they come to you, how do those play together?
It's a great question, David. I call it the triune pathway. And in my experience working with my clients and in my own life, if we use all three of them together, it brings a maximum kind of effectiveness. So it's weaving the psychedelic medicine into our dream life, understanding our dream symbols and the narrative that they're providing us, along with then doing ritual and ceremony to kind of bring it from the unmanifest into the manifest realm and say, I acknowledge this passage for myself. That is the triune pathway that I think is most effective for healing at all levels: mind, body, spirit, emotion.
Yes. And then for the listeners who are like super intrigued for themselves or for someone who's struggling with issues that they need to work through, are there classical cases where you're like, yes, I see this all the time. This makes a lot of sense. Or, this doesn't usually, it's not in my wheelhouse. So just to educate them.
Well, I think one of the things I want to suggest, or maybe the way that I wrote Psychedelic Dreams and Rituals, the first 50 pages is a guidebook. And anyone can buy that guidebook and begin to do their own inner work because it's got writing prompts and it's got a process through which you can really give yourself a great foundation for understanding your inner world. And part of it is where you live very externalized and very distracted, and we really don't have a lot of quality time that we spend with ourselves and exploring our own inner world. And so psychedelic dreams and rituals is this wonderfully engaging pathway into your own heart, soul, spirit, mind, body. One of the things that I think I've seen happen, and this is an incredible story, I do include it in the book. I usually don't work with people who have eating disorders. I have, and I'm familiar with them. But a woman reached out to me and she described what she was struggling with. She had been to some of the best treatment centers, in the world, and she still wasn't able to get through her anorexia and bulimia. And so I asked her to come in. We started working together just to explore. Now, one of my phenomenal teachers in this has also been Stan Groff. And Stan Groff has so many excellent books and very connected with maps. And one of the things that he really discovered in his holotropic breath work, because again, when the psychedelics were not available, Stan went to the holotropic breath work as a means to reach that kind of non-ordinary state of consciousness that can open us. He found that birth stories and our birth was significant in our healing process. And so I asked her, was there anything kind of unusual about your birth or stories about your birth that you were told about that was talked about? And she said, well, actually, my mom had to have an emergency C-section because she went to the doctor and her uterus was dying when she was in it. And so she wasn't getting proper nutrients in the uterus. And so sometimes she would have nutrients and she would be gobbling it all up. And other times it was nothing. She was starving, and it was elevating the heart rate of her as she was developing in the womb and in the uterus. And I said, did you hear what you just said? Sometimes you had this, the pattern had already been established pre-birth. She was either starving or she had nutrients. And so the anorexia and the bulimia had been woven into her inner world at pre-birth experience. And then once she was born, she was premature. She was in an incubator. She wasn't held. She wasn't touched. She wasn't comforted. I mean, there was like so many things that went into the patterning of that following that. So in our ketamine session that we did together, we repatterned some of that. She brought a quilt that her mother had made for her. Unfortunately, her mother had already passed away. This woman wasn't that old, but her mother had passed away. And so she brought her mother's quilt. And, as she was wrapped in this quilt and she was reflecting on this through her own experience, it was as if she kind of healed her own, mother wound, her body wound, and the anorexia and bulimia within the context of this, new story that she had shared. And, successfully to this day, although she has little, twinges of this come up for her, no more anorexia and no more bulimia. So it was over. And that is really stunning to me that, it's a combination of doing the therapeutic work and seeding that therapeutic work into the deep self with the ketamine assisted psychotherapy.
Wow, that's incredible. Thanks for sharing, Galen.
Yes.
And then When you wrote this book, what was the prime motivation for you to do it? Because writing a book is incredibly hard. And so I'm curious, like, what drove you to write this?
Well, MAPS president Rick Doblin has been on this path for, almost 40 years now, working through the legal system, the legal pathways to have psychedelic medicines, and particularly MDMA, approved through the FDA. And, I was in the Netherlands and I heard him speak at the conference. And there's a caveat to all of this. Having the medicine available is only one part of the quotient. If we have the medicine available, but we don't have the people to deliver it in an effective way, it's not going to go well. And he was saying that. He said, we need 20,000 therapists that are ready and prepared now. And so that when the medicines are approved through the FDA, that we can roll it out. And that really was my motivation. I was like, okay, I want to do this work. I'm doing the work. I'm going to write about it, capture it. Because I've been a therapist for 30 years, I already have a lot of tools in my toolbox that I know that are effective. And so it really is combining some of what I already have in my toolbox, sharing those tools with others, along with how does the psychedelic medicines, weave into this, whether it's ketamine, MDMA, psilocybin, how do they kind of work collaboratively, and how can we be effective in training one another? So I'm really, my mission is kind of driven by desire to train, so this is a success as it's rolled out.
Oh, beautiful. And when you think about being able to turn your lost cause into an unlost cause, and with psychedelics, do you feel that that has taken the efficacy of your practice up a notch, or is it the same? It just gives you more different options for different cases, or is it like, yes, the 1 + 1 equals like 5 now versus only having 2 in the past?
I think it's both, and it's not for everybody. And that's really important. My traditional and transpersonal psychotherapy that I do is the bread and butter of the work that I do. That's the mainstay. For some people that are appropriate and that really are struggling, particularly with long held depression and mental health illnesses, that they just haven't been able to break through. That's really the people that I feel are most effectively helped by the ketamine assisted psychotherapy, because they're almost at their wits end. It's like, I got to do something. And I have found nothing else that's effective. And so I get a lot of really tough cases, and with people who are, desperate to find some other kind of means to have that breakthrough for themselves.
Yeah. And then as you think about, this is a two-part question, like where do you think the future of the psychedelic industry is going to go? Is this going to just keep blossoming, or is it already reached like a point where it's like the society probably won't let it grow more? And then within that context, how do you see you and your practice, leveraging or growing with whatever trend you think is going to happen in the broad industry?
Great question. I want to use a personal example because 5 years ago, I have a really good, wonderful connection with my cousin Donna. She's been a nurse, an RN for like 50 years. His whole life has been nursing. And when I first told her about the psychedelics, she was like, "What are you doing? I don't know about this." And it was just this week she sent me something that Maria Schreiber had put out, and it was on psychedelic medicines, plant-based medicines, and help with postpartum depression. And she sent it to me. She goes, "Well, I guess this is the thing now." And so I was like, yay, I got cousin Donna, and I still feel there is a stigma, societal stigma. I mean, some people, I'm judged in a particular way because I use the word psychedelics, or I write about psychedelics, or I talk about psychedelics. It's just coming into a societal kind of awareness, but it's not 100% there. So it's still new. I was ahead of the curve which I'm glad, but I didn't realize how far ahead of the curve I was. So I've definitely suffered a bit from judgment and criticisms and unacceptance and, why would you do that? And exclusion. And I'm one of the few females who has written about psychedelics. Most of the people that are writing about psychedelics are men, and so it's kind of unique. And that's why I also dedicate my book to Maria Sabina. Maria Sabina was from Oaxaca, Mexico. She was the one who really discovered the mushrooms in the mountains. She would take her basket out and she knew what mushrooms to pick. Now, if you and I had to go out on a mountain and pick the right mushrooms, because some of them
We'd be
are
dead.
deadly, and some of them have this psychedelic component to them that can be healing. She knew which mushrooms to use, and she began to use those in ceremony. And she is the reason why we have Gordon Wasson did a story on her and front page of Life magazine and, highlighted Maria Sabina, took it to the labs at Santos and had them synthesized. And that synthesized mushroom is what we are continuing to use, to maybe not exactly that same formula, but a variation of that formula today. So that all leads right back to Maria Sabina. So it was really some of the women, and they were mycologists more than psychologists, but their mycology incorporated in with ritual and ceremony helped. They were the healers in their small communities.
And so does that mean that you think that the momentum for psychedelics is growing or stable or diminishing a little bit right now?
I think it's growing. And the reason I think it's growing is because Columbia University, Penn State University are doing programs to train RNs and therapists on psychedelic therapy. So that's the educational component is growing. The research is so vibrant right now, particularly with psilocybin, which is the plant-based medicine from mushrooms. And I saw some stunning research of how they're using this for Parkinson's, for fibromyalgia, for cluster headaches, for all of these things that we have kind of phantom limb pain management, along with anxiety, depression, PTSD, because we're really working with the brain, right? It's not just working, the brain and the body connection and how those neurotransmitters are firing. So this is stunning, the research that's coming out now. And I think we've just begun to see. And remember, psilocybin it's impossible to overdose on. It's impossible to, if you take too much, it stops working. It's got a natural governor or throttle on it. You can't, it will lose its effectiveness. You can't take it day after day. So there's research now backing it up. There's finances, there's corporations that are interested in this. I think the one thing that is maybe a little drawback is, like, say, for the end of life experience, where some people are struggling with that end of life. They don't need to take this like a prescription on a day-to-day basis, right? So you can have one really important, significant experience with a psychedelic that can be so life-changing. You don't have to do it over and over again. It's a one-time experience, and you really, it reveals to you your oneness, the awe, the wonder, all of the things that mystical connection sometimes that takes away that fear at the end of life. But it's not something the pharmaceutical companies can sell like we're going to get to, if you only have to take it one time, how much money are you going to make on that? And so I think that's kind of an interesting part of this too. It's not going to be a huge money maker, but it is a huge transformational experience is available and can help many people.
When you were on the cutting edge and you were getting a lot of judgment, like, oh, you're dealing with these substances before, now you mentioned it's going to become more and more mainstream. Like, how do you feel about it looking back, where you're like, oh, well, I was ahead of the curve, or is there a vindication, or how do you feel about it today versus, like, when you were getting a lot of pot shots and judgment?
I feel as though You have to when we have to go for myself. I need to go on based on my own inner truth. You know, I had a very clear message, and it came through the dreams as well for me that it was time and that we actually need this right now much more than perhaps we realize because we are so disconnected. And unless we understand our oneness, unless we can, kind of appreciate our connectedness, then we become more separated, more segmented, more, pulled apart, so to speak. And that's not a good place for us to be in the world today, and, the psychedelics, the medicine, the plant-based medicines remind us of our connection to one another, to the earth. It kind of teaches us more about acceptance. And so I want that to be, I'm passionate about that. I want people to have their own individual healing, be more connected within themselves, and live in a more connected world.
And then what advice would you give someone who's listening? They're like, oh, this is incredibly interesting around curious about the therapeutic psychedelic usage or the dreams and the ritual usage in their own lives or for someone who they know.
I would go, if you were interested in working with someone, just make sure they have training. I wouldn't go underground because although the above ground has been informed by the underground, there is a synergy there, and we couldn't be as far ahead as we are today without the underground. I think you got to be careful who you're working with, and it has to come, be sure you're meeting with somebody who knows the medicine and can guide you through the experience effectively. The book gives them the foundation to, it tells you all the things to look for, all the things to do, setting your intention, using the grounding and the breathing techniques, connecting with your inner healer. All of us have this inner healing consciousness, this inner healer that's inside of us that can inform and guide and direct us. We have to make time for it, and we have to make those connections with the inner healer. And so the book helps with guiding people into that connection with their deeper self, with their wise self, with their intuitive self, with their dream self. And so those things are all like, I use the analogy of a garden. And, if I want to plant a garden, I have to start by breaking up the clumps of dirt in the soil, right? And so, this is the way I'm working with people all the time. We're breaking up the clumps of dirt. We're chopping the ground up so that we can plant seeds in the ground and those new seeds can take root. If we just throw the seeds in the garden and we don't prepare the ground to receive it, you're going to have a mixed experience, and that's just like psychedelic medicine. If you just go, I think I just want to do some whatever, you can have mixed experiences if if you haven't prepared the ground of your being to receive it.
Yeah, that's wonderful. And as you think back on your career and, first doing classical therapy and then with dreams and rituals and then psychedelics and then writing a book and that body of work, like how proud are you of these accomplishments?
I'm incredibly proud. And, the book was endorsed by Rick Doblin. That was a major, endorsement for me. And I'm proud that, I'm a female that's breaking ground in this work too, that, there's not a lot of females that are they're somewhat doing the work, but not doing the quantifying of it, but through the writing and through the, sharing. And I've now done hundreds of sessions. And so, I have a wealth of background and knowledge in this, which just adds to my own sense of peace and serenity and courage when I'm working with people, because I'm holding the container with them, and so you really have to be, kind of mature in your work, in your own life in order to do this work. And I've honed myself as instrument through which the work can happen. I don't do it. I can't do it for anybody, but I can, I love the analogy of being a spiritual midwife, I'm there helping you through the contractions and reminding you to breathe. And, I'm going to stay with you until you've had the birth, and at best, I feel as though that's a part of the role that I get to play. And it's a honor and to be able to play that role. And I'm very proud that I'm able to.
Yeah. And, in the UnLost Cause community, we celebrate people like yourself who after 40, and you mentioned the word courage to, lean into that and incorporate the psychedelics. What advice would you say for someone who's harboring something and they're 40 plus, but they're just like, they don't have the spark to jump or that courage yet? What advice would you give them?
I would say, what are you waiting for? Don't wait any longer. And really, the people who do best in life are constantly reinventing themselves, right?
Hmm.
And so
Hmm.
this is a part of our own, evolution. And so I've reinvented myself several times, through my work, through my writing, and I'm continuing to reinvent myself. This was a kind of reinvention, and it brings new energy, it brings new vitality, it brings new creativity, it brings new people into my life. So, what are you waiting for? Don't wait. Take the next step, read the next book, take that, be willing to make mistakes and let it be a messy, and it's okay, but you'll work through that and you'll gain knowledge and wisdom through that experience.
Oh, that's great. And one of the questions we always like to ask guests is like, what ask do you have of the Unlost Cause community? And I love this question because it goes in so many ways for different people. So I'm curious what ask you would have for the community.
I think the ask for the unlost cause is, when you think a part of your life is over, and it doesn't have any life, it would have been really easy for me to leave that box with this psychedelic experience on the shelf for the rest of my life. And so the ask is, what have you put on the shelf? And what's in that box? And is it, time to kind of pull the box out, open it up? Maybe you had a dream or a passion to work in a particular way, or to explore in a different way, or to travel in a different way, or to have different types of cultural experiences in your life. And now it's the time. You take the box off the shelf, and I'd ask, what's holding you back? What are you waiting for? It's going to take time. It's going to take energy. It's, time and money are the two, main values, how much time, how much money. If it's your passion, ask yourself, what am I waiting for? It's time for me to explore and reinvent and reinvigorate my life. The Dead Sea is dead because it has no inlet and no outlet. And that's really important for us to remember. We have to have fresh inlets and out, and we have to have fresh energies going out into the world in order for us to live and to be vital and alive and joyful and expansive. And so, we don't want to be like the Dead Sea, nothing new coming in, nothing going out. We want to be, fresh inlets and outlets of energy, ideas. And I would ask our listeners to have the courage, to reinvent themselves.
I love the vitality and the positive energy, and this time is just flying by. But if people want to support, buy the book, maybe even reach out for if they're in the area, how can they follow or learn more about you and your book and other resources that you offer, Gayen?
They can go to Amazon. The book's readily available and it's on audio. So there's a couple of different options to receive the book through Amazon. They can go to Gaylyn, GAYLYNN.net. Super easy, super simple, gaylyn.net. And all the pictures from, some of my friends that I met along the way at the psychedelic science conferences and in Europe and the Netherlands are there. There's also ways to connect with me personally if you want to work with me as in counseling or in preparation for your own medicine ceremonies. I'd be happy to work with folks as I can. I'm training. And so if there's listeners who are interested in getting trained and want to deepen their own experiences, I think that training piece is a passion that I have, and I really see myself, working in small groups and training, maybe doing and this is some idea that I'm proposing to work with therapists. I already do group work. I use ketamine and equine therapy to combine together. I use ketamine with breath work combined together. I do ketamine with psychodrama because I'm also trained in psychodrama, which has been very interesting. I've really experimented quite a bit, and small groups and individual and couples. So I've really allowed myself to explore and expand into these other areas, and it's been very interesting and very effective. So those are some ways I'm working with veterans. So that's been effective too in helping them through some of their anxiety and PTSD. So I'd like to train and share my knowledge. And so I see, maybe small groups of therapists or facilitators getting trained, and then perhaps we come together and experience a ceremony together. So I think that's kind of the edge that I'm on now, not just doing it as an individual one-on-one, which is very effective, and I'm happy to do that, but also doing it in small groups and training others to take this work out there.
Well, that was wonderful, Gayen. And for the listeners, I want you all to know, Gayen's journey didn't follow a perfect path, but it was an authentic one. From a teenager LSD trip to a professional psychedelic therapy practice decades later, her UnLost Cause reminds us that, sometimes the middle is messy and sacred and you have that box, but growth doesn't always come from a linear passion, and you can always go back to it. And that's just part of the journey. So if you're curious about the role of dreams, rituals, and psychedelics in healing, her book and newsletters are great places to start. You can find both of them at gayengrigas.substack.com and gayen.net. And if this episode gave you insights, goosebumps, please like, subscribe, and share. Thanks again, Gayen.
Thank you so much, David. This has been magnificent. You're a wonderful interviewer. I thank you for the engaging questions.
Before you go, if you're inspired and want to be a part of something bigger, subscribe, like, and share to help more people reclaim their dreams and live true to themselves. Also, let me know if you or someone you know would be an inspiring guest on this show. Together, let's spark courage to live without regrets. The UnLost Cause way, one story and one person at a time.